All right, so in this video, I'm going to talk a little bit about some of the types of long-term care. First one is going to be skilled nursing care. So skilled nursing care is basically referring to the situation in which the person needs like actually skilled medical attention as their care. So significant medical issues are involved, things like that. And this is typically going to be associated with more what's considered inpatient facilities. So hence the term, patient. So you are kind of a patient at this point because you're receiving actually sort of, skilled nursing care or skilled medical care. So this is going to require people with nursing degrees and things like that to be supplying the care. Custodial care is going to be a situation in which the person doesn't really have sort of other significant health issues per se, in terms of, generally they're relatively healthy. They don't have like crazy treatments they need or things like that. But maybe somebody who is suffering from some level of cognitive impairment, but is otherwise healthy. And so they need a person to assist with, basically making sure they don't, do something dangerous, like leaving the stove on or something like that. And that's more of a custodial care. So it's, not non-skilled, but just kind of, day to day around helping with some tasks of daily living a little bit. It basically is making sure the person doesn't do something dangerous, that kind of thing. So that's more of the custodial care kind of an idea. Home health care would be a health care that is kind of provided within the context of the home. And in some cases, this can involve some people who are providing some medical expertise or things like that, possibly. So there may actually be some intermittent skilled nursing kind of care, possibly some physical therapy, things like that, possibly. So it's kind of a little bit of a mixture, but generally it's administered at the person's home. And then that brings us to hospice care. Hospice care is a facility that is specifically targeting individuals who are in the terminal stages of illness. And so if it's reached a point at which a person has an illness that is, it's no longer treatable, and they have 6 months to live or 3 months to live or something like that, but they're terminal stages, they need a lot of care, then that's where a hospice care facility comes into play. Because it is more oriented towards sort of managing the situation. They aren't trying to treat it. It's managing the person's situation because it's terminal and there's nothing they can do to cure it, basically. Adult daycare services is kind of what it sounds like. So if you are caring for perhaps an elderly parent, and you need to work, kind of like if you had young children where you could drop the young kids off at daycare on the way to work. Adult daycare works kind of similarly, where basically you drop the adult parent that needs to go to the facility off on the way to work. And so in that case, it's more of some support and a place for them to go during the day while somebody is working. And so they get some supervision, but they don't necessarily need you know, like lots of medical care or anything like that. It's really more helping to make sure they don't become a danger to themselves, and provide some an environment for them to be interacting with other people, things like that. So it's generally probably on the lighter end of the spectrum in terms of services. You'd expect that the person is in the adult daycare is still generally probably decently functional and things like that, but just needs some supervision. That's the kind of the idea. Then you take another step to basically assisted living facilities. So assisted living facilities are arrangements in which basically the people are living in a facility that sort of they kind of have their own place. So it maybe sort of feel like their own like apartment or something like that, or a condo almost. But it is in the context of a broader sort of community that has people on staff and things like that that can provide some level of assistance. And this would be, again, for people that are relatively functional, relatively able to do the kinds of things they need to do from day to day, but they need a little bit of help here and there. If they're needing help constantly, then that's not quite the point of assisted living. It's more, they're most independently capable of doing things, but maybe they need a little bit of help. And so that would be more the idea behind the assisted living. So they might help with laundry or some degree of housekeeping, things like that basically. And there may be some degree of health assistance that's provided there, but it's not like it's not as intensive as you would have at like a nursing home kind of facility or anything like that. It's still generally the people who are dealing with assisted living are mostly taking care of their sort of day-to-day things. They just get a little bit of help, basically. It's kind of more the idea behind assisted living. Now, if you go to kind of the next step, that's when you get to kind of long-term care services. And that can involve basically both medical or non-medical kinds of care. So the medical side of things, somebody might need help with getting some kind of therapies or treatments or things like that. On the non-medical side, then if I start dealing with that, then this is more of helping with just ordinary activities of daily living, bathing, cooking, getting out of bed and into a chair. I mean, you start having more of those activities of daily living and so forth. And so there starts to be a lot more involvement in the person's actual like moment by moment life with more long-term care kind of services. And then that kind of brings us to kind of skilled care and immediate care facilities, intermediate care facilities. So for skilled care facilities, this is more what you think of as sort of the stereotypical like nursing home kind of a scenario where you actually have like nurses on staff that are basically helping with kind of the ongoing treatments of the people who are in there, administering medicines, helping them out with some of the daily things, but also they may be having to deal with more specific medical conditions and things like that. So you have a lot more of the medical side kind of involved there with kind of the skilled care kind of facilities. The intermediate care facilities sort of have some of that component, but they have maybe a bit less of the medical side, and so it's kind of somewhere in the middle there, where you're getting some of that kind of custodial assistance, where you're kind of helping out with things generally, but also some degree of medical care, but not the same frequency or intensity, generally speaking. Okay, hopefully this video has been helpful, and hopefully you found it interesting. Have a great day, and thank you for watching.